Kayla, and I'm going to be doing the cranial nerve test as well as the spinal test. So first I'm going to start with cranial nerve number 1, which is the olfactory nerve. So I want you to plug one nostril and breathe in, and plug the other nostril and breathe in. Okay, both nerves are paying. Now what I want you to do is close your eyes and plug one nostril, and I want you to tell me what scent you smell.
Cinnamon.
Okay, and then do the other side.
Coffee grounds.
Great. Cranial nerve number 1, the olfactory nerve, is intact. Cranial nerve number 2 is the optic. So first I'm going to have you start by reading the Rosenbaum card. So hold it about 14 inches away from your face and cover one eye and read the lowest line you can.
4, 2, 6, 7, 3, 9.
Okay, and the other?
4, 2, 6, 7, 3, 9.
Great, and then both together.
4, 2, 6, 7, 3, 9.
Okay, so visual acuity is 20/20 bilaterally without correction. And now I want you to look straight ahead. I'm going to check your pupils, okay? Pupils are equal, round, and reactive to light and accommodate. And I'm going to look one more time. Okay. Direct and consensual response is intact. Now I'm going to check your peripheral vision. So I want you to tell me when you can see my fingers come into your view, okay?
Now. Now. Now.
Great. Peripheral vision is intact. Cranial nerve number 2, the optic nerve, is intact. Cranial nerve number 3, which is the oculomotor, cranial nerve number 4, which is the trochlear, and cranial nerve number 6, which is the abducens, will be tested together using the H test. So I want you to look at my finger and just follow my finger with your eyes. Okay, cranial nerve number 3, cranial nerve number 4, and cranial nerve number 6 are intact. Cranial nerve number 5, which is the trigeminal, I want you to clench your jaw really tight. Okay, and now I want you to tell me if you can feel my fingers on both sides equally.
Yes. Yes.
Okay, the V dermatomes of cranial nerve number 5 are intact. And I'm going to be placing something near your eye, and I want you to just, okay, the blink reflex is intact. So cranial nerve number 5, the trigeminal nerve, is intact. Cranial nerve number 7 is the facial nerve. So what I want you to do is clench your eyes really tight and don't let me open them. Okay, now I want you to raise your eyebrows as high as you can. I want you to smile, frown, and puff your cheeks out. Great. Cranial nerve number 7, the facial nerve, is intact. Cranial nerve number 8 is the acoustic. So I'm going to start by the whisper test. I'm going to whisper something in each of your ears, and I want you to tell me what I say.
Soccer. Tennis.
Perfect. And now I'm going to do the Weber test. So tell me if you can hear this in both ears equally.
Yep.
Okay, there's no lateralization. Now I'm going to do the Rhine test. Tell me if you can hear this.
Yeah.
Tell me when you stop hearing it.
Now.
Can you still hear it?
Yeah.
Okay, air conduction is greater than bone conduction. And now the same thing in the right ear. Can you hear this?
Yes.
Tell me when you stop.
Now.
Can you still hear it?
Yes.
Okay. Cranial nerve number 8, the acoustic nerve, is intact. Cranial nerve number 9, which is the glossopharyngeal, and cranial nerve number 10, which is the vagus, will be tested together. So I want you to stick your tongue out and say, ah.
Ah.
Okay, the gag reflex is intact. The posterior pharynx rises and falls symmetrically. The tongue and uvula are midline. I have heard my patient speak, and her speech is clear and articulate. So cranial nerve number 9 and 10 are intact. Cranial nerve number 11, which is the spinal accessory nerve, I want you to push your shoulders up, shrug them up against my hands. Okay, and then I want you to turn against my hand. And again. Great. cranial nerve number 11, which is the spinal accessory nerve, is intact. In cranial nerve number 12, which is the hypoglossal, I want you to stick your tongue out, put it back in, and push your tongue against each of your cheeks. Great. Cranial nerve number 12, the hypoglossal, is intact. Now I'm going to do your spinal exam, so stand up, please. So we're going to start with your cervical spine, and I want you to follow what I do. Flexion, extension, lateral bending, and rotation. Great. The cervical spine range of motion is intact. And now I want you to turn around. Your thoracic spine, I want you to let me know if you have any pain.
No.
No pain. Okay. And then for your lumbar, I want you to do the same thing. I want you to bend over and touch your toes in flexion and backwards in extension. Sorry. Backwards in extension, rotation, and lateral bending. And the lumbar spine range of motion is intact. And that will conclude the video.